recover all the same ground, but as I guess you know, Genesis Health System is, we now have approximately 6,000 employees, so we'd be the largest employer in Scott County. Not all 6,000 are in Scott County, although the majority are. Rock Island, Jackson, Mercer County also have, well, and beyond, but those four certainly. We have instituted a recycling program, and I'd be happy to provide you with the gee whiz facts about that, because I recently had to sort it all out, but I didn't know what precisely we're going to focus on tonight. But I mean, you know, there's a million swimming pools saved and more, you know, all that kind of stuff. So I have all that for you, and I'd be happy to send it to you. We're putting a rooftop garden on our hospital. We've redirected our marketing dollars away from billboards and onto city buses to help support public transportation as a means of reducing single car use. We participate in any number of other programs, Thrive and Let's Move Davenport and other such things, all intended to, we're all talking about the environment so far, which is really great, but according to your definition, you know, caring for the people is part of your sustainability, and to that end, we provide, well, last year we provided $62 million in uncompensated health care. What else can I tell you? Okay.
Why don't we I wanted to touch.
Oh, I'm sorry. A friendly amendment. As chairman of the library board, I just thought I'd mention that we've just opened our first LEED certified library in Scott County as well. So I think the first and only LEED certified library in Scott County. Thank you.
We want to take a look at the slides. The steering committee also had some things that, as organizations, they're doing, and very similar to some of the things that you've noted already. We won't go over these in detail, but we are collecting some of the things to at least recognize that there are organizations out there already doing things that are sustainable and can only improve on that. So our next slide is about talking to you about gaps. We wanted to really talk tonight and focus on the economy and find out what you think there needs to be to make our economy more sustainable. You know, we did an assessment, and some of the things that, you know, with sustainability that people look at are, you know, are we going to be competitive for our future workforce? Do we have the critical infrastructure that we need? People talk about creating and retaining jobs. Well, what kind of jobs are we looking for? And so I don't want your input on what the gaps are out there from your perspective in your organizations, and we'll record those and hash it out and then look at, you know, what might be some solutions.
I can tell you that 1 in 5 Iowans is employed directly in healthcare. There are more Iowans employed working in healthcare than in agriculture and financial services combined. We have an opportunity to become the healthcare mecca of the country. We have the lowest cost and the highest quality, consistently. We do not have a workforce that is in place to carry that vision forward.
Well, I
we're attempting to fill those gaps on a quad city, on a regional basis. You're all, I'm sure, keenly aware that Genesis and St. Ambrose just opened up a College of Health Sciences to produce more of our own homegrown talent. But in light of Medicaid reimbursement rates, in light of quality of living, in light of any number of instances, the majority of those people we grow at home will leave us. They won't stay and work here because the grass is just way too greener elsewhere. Our quality of life is Dee and I talked many months ago about mental health. We have a mental health clinic, mental health ward, which is not what you call it, behavioral health center at Genesis that is opened but empty because we do not have one psychiatrist who can admit patients. There are, like a couple of dozen, maybe not even a couple of dozen, psychiatrists in Iowa. The residency program, which is the only residency program in behavioral science at the University of Iowa, graduates 6 psychiatrists a year, and on average we retain less than 1. We're headed in a bad direction to sustain our most, our largest sector, employment sector, in the state and in the Quad Cities.
Services are a requirement of a county that has 165,000. And you don't have them here, and people have to travel, or they don't have services at all. These are definite.
And we're keenly aware of the mental health issue, but please don't believe it's limited to that. We've been trying to recruit a neurologist for about 2 years now. The issue is, again, even before we had our collaboration with St. Ambrose, Genesis would offer scholarship money for nurses. We would pay their tuition to go to St. Ambrose, and they would agree to work for us for 2 years or whatever they would agree to work for. They would graduate, they would be offered signing bonuses in Illinois, Pennsylvania, Florida, wherever, pay us back and leave. It was cheaper. More profitable for them. We're not headed in a good direction, I don't